Hello everyone, and welcome to Canine Wellness Online. Has your dog recently had a TPLO surgery and you're not exactly sure what happened? They told you, but the information was so overwhelming it just probably went like this. So what I want to explain to you today is exactly what it means when your dog has a TPLO surgery. As you've seen in my other videos, I've told you exactly what happens when the cruciate ligament tears. So in this video, I want to discuss with you exactly what it is they do to repair that. So first, what you need to know is when they do TPLO surgery, they are not repairing the ligament. The ligament, with the surgery they do, has no purpose any longer. So what they're actually doing is change the angle of the joint. So what they do is they do a circular cut just here. So it's a little round sort of cut there. And what they're doing is they're changing the angle of the joint. So if you watched my last video, we talked about how the femur rocks backwards. So what they actually do, it's called a tibial plateau leveling osteotomy. So tibial plateau is this flat bit there. Leveling means when they cut the bone, they're making it so it's straighter, and an osteotomy means cutting of the bone. So basically what they're doing is changing the angle, so now the plateau is straight, so now that can't rock backwards, so you don't have an unstable knee any longer. Now, once they've cut that bone, the reason why you get all these red warnings all over the take-home sheet is because your dog effectively has a broken bone. So what they do is they put a plate on, and the plate, its job is to keep that bone in place. So this is an example of a plate. This was taken from a dog, one of my clients' dogs that had basically an allergic reaction to it and got an infection. So they took the plate out. And this is what the plate looks like. And basically what they do is where this cut is they put this plate on, and then there's these screws that go in there, and the screws hold the plate in place over the top bit and the bottom bit. So this is the hardware. It's actually on the inside, but this is the hardware that you would see if you were inside the joint. So this hardware stops that bone from moving. So the reason you get all these warning signs from your surgeon, which is rightly so, is because you don't want anything like what I have seen is dogs that have moved too much or done too much jumping on and off the couch or up and down stairs. And what happens is these screws that go into that plate, what can happen is they start to migrate out. And I've had dogs where I can feel the screw with my finger on the inside of that knee joint. So what does it look like? So you know, usually at week 8 to 10, you go and get an x-ray. So what they're looking at in that x-ray is how much the bone has started to fill in or regrow, for lack of a better word. So here's an x-ray of a dog that was at 8 weeks post-op, and you can see there's that circular groove, and if you knew how to read an x-ray, but basically it's starting to fill in a little bit. And in this particular dog's case, the dog had been doing a bit too much activity, and it actually fractured the fibula, which is back there. So that's another reason why you don't want to do too much activity. Some activity is fine, and if you've watched some of my videos, and if you do participate in my online 12-week program, I help them maintain muscle while the bone starts to heal. So if we look at the x-ray on the other side, so you can see here's the plate, here's the broken bone, I don't know if you can see that or not, and then here's all those screws in there. And that's what's holding your dog's broken bone together. So hopefully that explains a little bit better what is going on inside your dog. One other thing to mention, I have had owners that have taken the plate out afterwards because they just didn't want a metal implate in their dog. You can do that. It's a fairly minimally invasive surgery. However, these days with prices of veterinary medicine, probably not something you're going to want to do unless you have a dog that's not reacting well to the plate. So thanks for watching, everyone, and don't forget to subscribe and like, and stay tuned for my next video.